Let's discuss face reading hypotension. In general, when the arterial blood pressure of an adult upper extremities is lower than 90/60 mmHg, it is considered hypotension. Most cases of hypotension are chronic and the blood pressure is consistently below the normal range. Hypotension can be classified into acute hypotension and chronic hypotension. The former includes symptoms such as dizziness, blackout, feeble extremities, cold sweat, palpitation, and scanty urination. In severe cases, the manifestation include syncope or shock. Chronic hypotension does not show obvious symptoms. Factors such as heart disease, peripheral blood vessel dilatation, temporary blood loss in great amounts, and hypothyroidism can all cause hypotension. Face reading. When wavy capillaries appear extending on the whites from the iris to the inner sides of the eyes, flaking to the bridge of the nose, it indicates hypotension. If small depressions appear in the earlobe, it suggests the risk of hypotension. These are the illustrations of the way the capillaries appear extending on the whites, and also the small depression appear in the earlobe. Therapeutic methods maintain a regular work and rest schedule to ensure adequate sleep. Increase nutrition intake and eat nourishing foods such as longan, red dates, and lily bugs. Frequent exercise can regulate the nervous system and enhance the cardiovascular function. Massaging certain acupoints can stimulate blood circulation, improve heart function, and invigorate physical function. Press knead the Shenshu, Dang's Hong, and Guan points with your thumb or middle finger. Press kneading each point for 1 to 3 minutes, 3 times a day. Apply force evenly and slowly. This massage will improve the symptoms of hypotension. Okay, just observe the illustration, bladder 15, REN 17, and REN 4. Thank you for your attention.
Let's proceed to interviewing. We have a case history, endometriosis, blood stasis deriving from cold in the uterus. A 28-year-old woman had been suffering from painful periods since menarche. The periods came regularly and lasted 9 to 10 days. The menstrual blood was dark with occasional clots. The pain was stabbing at times, but at other times, it was a dull, deep ache rather than a pain, and with a pronounced feeling of heaviness. She said, "My whole lower body feels thick, heavy, and stodgy," which was clearly her way of expressing what in Chinese medicine is called a feeling of heaviness. The pain was situated in the central lower abdominal area and was alleviated by a hot bath. Recently, she had been experiencing pain on intercourse, which was sharp and also located in the central lower abdominal area. Apart from painful periods, she had been experiencing a dull mid-cycle ache on the right lower abdominal area for the past 2 years, which was accompanied by a dark brown discharge. She also suffered from premenstrual tension, manifesting with irritability and distension of the breasts and abdomen. On the basis of an internal examination and an ultrasound scan, she had been diagnosed as suffering from endometriosis. Other symptoms elicited from interrogation included cold limbs, occasionally a feeling of heat in the face, palpitations, anxiety, and tightness of the chest. The tongue was red on the tip and the pulse was slightly slippery in general and slightly tight on the left rear position. The stubbing character of the pain and the dark color of the menstrual blood with clots clearly indicates blood stasis, which most probably derives from cold in the uterus. We can deduce the presence of cold in the uterus from the alleviation of the pain by a hot bath and also by the history. In fact, if the periods are painful from the time of menarche, the most common etiological factor is invasion of the uterus by external cold due to playing games wearing shorts in cold and damp weather. In this case, therefore, cold in the uterus obstructs the circulation of blood and causes blood stasis. In addition to blood stasis, there is also a clear pattern of dampness in the lower burner, manifested by the occasional dull ache during the period, the pronounced feeling of heaviness, and the mid-cycle pain. There is also some liver qi stagnation causing the premenstrual symptoms. Occasional feeling of heat in the face, cold limbs, palpitations, anxiety, and tightness of the chest can be explained as manifestations of rebellious qi in the penetrating vessel. In fact, given the symptoms and the menstrual symptoms, we can say that all her symptoms reflect a disharmony of the penetrating vessel. The main treatment principle is therefore simply to regulate the penetrating vessel by warming the uterus, invigorating blood, and resolving dampness from the lower burner. Thank you for your attention.
Let's continue our discussion with the hand Yin lung meridian with the acupuncture point Yu Chi or the face region. Lung 10 is located on the palm, radial to the midpoint of the first metacarpal bone at the border between the red and white flesh. Lung 10 is the fire point, the yin spring point of the lung meridian. Fish region is an extremely powerful point, one of the most powerful of command points. The mix of fire within metal creates a special alchemy. As with all alchemical processes, it has to occur at the correct time when sufficient foundation work has already been done for the full potential of this point to be realized. Metal acts as a conductor of fire's radiating heat and animation. The resonance of fire in the context of the lung can touch the spirit of a person in a profound way, opening them and reconnecting them to a sense of connection and higher purpose within themselves. It promotes a rebirth of spirit, facilitating both communication and connection within oneself and with the heavens. The purifying aspect of fire supports the clear qi necessary to the role of lung and helps to dispel the tarnish and cynicism with which long-term disappointment and grief can afflict the lung. As the fire point in metal, fish region can infuse the lung with the vitality and mutability of fire to ease the rigidity and coldness of the body, mind, and spirit into which metal can fall. When a person is overly detached, cut off, cannot respond to affectionate communication, and is too easily offended, fish region or lung 10 can soften, make malleable, and help the spirit regain the glisten and grace of the lungs and heart in good communication. When the person feels unable to communicate from their shen, is desperate and isolated, this point helps reestablish the person's awareness of their connection to their own shen and also to the qi of heaven. Fish region is activating and expansive and can motivate the spirit to move on from inertia and imbalance. If the person has been constantly disappointed and is seeking validation in the acquisition of material possessions, this point can realign them with their true quest for value and love. It is a reminder of how closely the supreme controller and receiver of qi are connected. It can be used with moxa if the lungs have become very cold, but be wary of overheating the lungs and metal element. More often used to clear lung heat in its capacity as a yin spring point, especially in acute situations. Lung 10 is indicated for depression, desperation, and isolation. It is also for acute or chronic sore throat from lung heat or wind heat, but this is not the point of choice when there is retention of phlegm. It is for more acute, earlier stages of full lung heat. This powerful command point brings warmth to the metal. It is particularly helpful when the patient is inert, cut off, isolated, or finds difficulty making contact with others, or who is lacking in emotional warmth. This point can be tonified if the skin is cold, silvery or flaky, or sedated if the skin is hot, ugly, and red. An important note, the skin is our third lung and is the largest organ of the body. Thank you for your attention.
Differential diagnosis for edema. Western differentiation. We consider the local causes like inflammation of the joint. There is edema of joint, stiffness and pain, bruising if caused by injury. Lymphedema, chronic swelling of the arm due to lymph node removal. Cellulitis, skin lesion or rash with redness and inflammation, tight, glossy skin, fever. Abscesses, skin redness and inflammation, tender to touch, warm to touch, may point and come to head, may rupture causing infection, fever. Phlebitis, skin redness and inflammation, tenderness over vein, pain in affected part. And varicose veins, edema of ankles, pain, fullness, aching legs, visible enlarged veins, discoloration, ulcers at the ankles. Generalized causes stemming from kidney pathology, we have acute nephritis and nephrotic syndrome. For acute nephritis, there will be swelling of the face, around the eyes, arms, hands, feet, abdomen, blood in urine, decreased urine volume, raised blood pressure, general aches, pains, malaise, headaches, blurred vision. Nephrotic syndrome, swelling of face, around the eyes, feet, ankles, abdomen, foamy urine, weight gain, poor appetite, high blood pressure if kidneys fail. Stemming from heart pathology, we have congestive cardiac failure, swelling of feet, ankles, abdomen, weight gain, pronounced neck veins, loss of appetite, nausea, vomiting, shortness of breath, exercise intolerance, palpitations, cough. Stemming from liver pathology, we have cirrhosis, swelling of the legs, ascites, vomiting blood, confusion, jaundice. Chinese differentiation for edema. Diagnostic questioning according to organ interrelationships. You have the Shang-Ku cycle relationships between spleen and lungs. This is Tai Yin. Kidney and heart, Shao Yin. According to type of edema, for rapid onset beginning at the head, accompanying external invasion, this is wind cold invading the lungs or wind heat invading the lungs. Generalized edema, moist glistening skin, abdominal distension, fullness in the chest or abdomen. This is damp combining with heat. Gradual onset generalized edema of limbs and trunk, especially lower limbs and abdomen, severe enough to hide a pressing finger. Spleen Qi deficiency with damp obstruction. Stubborn recurring edematous swelling, most pronounced below waist, pitting, slow to resolve. This is spleen Yang deficiency. Generalized edema, pitting, slow to resolve, starting waist, feet, worst in lower body, especially around medial ankles, kidney Yang deficiency. Gradual onset edema in the face and limbs is Qi blood deficiency. Etiology, external wind, exterior dampness, poor diet, excessive consumption of foods, especially damp-producing food, which impairs spleen's function of transforming and transporting fluids, overwork and excessive sexual activity, weaken the kidneys and impair their function of transforming fluids. The Zhang-Fu patterns for yang edema, we have wind cold invading the lungs, wind heat invading the lungs, damp combining with heat. For yin edema, we have spleen Qi deficiency with damp obstruction, spleen Yang deficiency, heart Yang deficiency with water overflowing, kidney Yang deficiency with water overflowing, and Qi and blood deficiency. Thank you for your attention.
Let us now go to Qi transformation. The topic is dynamics. The direction of movement of the various types of Qi in various physiological activities is the key for preserving normal Qi transformation. For certain physiological activities, Qi needs to ascend, and for others to descend. In ancient China, people often express these two movements in relation to heaven and earth. Heaven pertains to Yang, and Yang descends. Earth pertains to Yin, and Yin ascends. The plain question states the ascent-descent of Qi is manifested in the alternation between heaven Qi and earth Qi. Again, descent comes after ascending to the zenith, and the one that is descending pertains to heaven. Ascent comes after descending to the nadir, and the one that is ascending pertains to earth. Heaven chi descends and flows on earth. Earth chi ascends and soars in heaven. Hence the high and the low call each other, and ascent and descent cause each other, in so doing giving rise to all changes and transformations. Again, clear yang becomes heaven, turbid yin earth. Earth chi ascends and becomes cloud. Heaven chi descends and becomes rain. Rain comes from earth chi and cloud comes from heaven chi. Therefore, clear yang exits the upper orifices and turbid yin exits the lower orifices. Clear yang diffuses into the interstices and turbid yin flows into the zang viscera. Clear yang invigorates the four extremities and turbid yin returns to the fu viscera. This quote uses the ascent, descent, and mutual transformation of water and chi between heaven and earth as an analogy for the metabolism and chi transformation in the human body. Whether chi ascends or descends or moves otherwise is determined by the functional characteristics of the Zangfu viscera. The ascent-descent of chi and its entering-exiting is a unity of opposites, but each visceral organ has a special effect on the ascent or descent of chi. From the local point of view, it is not necessary that each physiological activity must have both ascent and descent or entering and exiting. Instead, each has its own pattern. For example, liver chi and spleen chi ascend, lung chi and stomach chi descend, heart yang descends, and kidney yin ascends. From the point of view of the totality of physiological activities of the body, however, there must be dynamic equilibrium between ascent and descent and between entering and exiting. Only then can normal physiological functioning be maintained. Thus, the ascending, descending, exiting, and entering of qi are an important factor in the regulation and balancing of the many physiological capabilities. Thank you so much for your attention.
Let's now proceed to diagnosis according to Zangfu organ patterns, the pattern gallbladder damp cold. This pattern and gallbladder damp heat are very similar in their etiology and pathology. There can also be a progression from one to the other. The tongue and pulse will be some of the most crucial factors in differentiating between these two patterns. Now let's go to its etiology. Dampness in the gallbladder can arise when there has been an excessive consumption of fried food or food with fat content such as dairy products, fatty meat, and so on. Exogenous damp can also invade the body and disrupt the functioning of the gallbladder. Damp can be internally generated when there is qi deficiency. If there is liver qi stagnation, this will exacerbate the stagnation that is caused by the dampness. The signs and symptoms. There will be yellowish colored skin, yellowish sclera, hypochondriac tension, costal pain or distension, abdominal bloating, nausea or vomiting, especially after intake of fatty food. There will be sensation of heaviness in the body, heavy headache, sensation in the mouth, ulcers, cloudy or oily urine, loose or puddle-like stools that may be clay-colored or very pale, thick, greasy or sticky tongue coating that is either one-sided or has a wide stripe of coating on each side of the tongue. The pulse is slippery and wiry. The key symptoms here are yellow skin and eyes, tightness, pain or distension below the ribs, sticky white tongue coating. Fitton principle, we drain dampness from the gallbladder and spread qi. For the acupuncture points, you can choose from gallbladder 24, gallbladder 34, G41, spleen 6, spleen 9, Sanjiao 5, Sanjiao 6, liver 14, Danang She, the extra point on the leg, UB18, UB19, UB22, and Do9. The needle technique is draining. To explain the choice of points, gallbladder 24, 30, and 34, do 9 and bladder 19, drain dampness from the gallbladder and spread gallbladder chi. Gallbladder 41 and sundial 5, open diami and drain dampness from the gallbladder. UB22, spleen 6 and spleen 9, drain dampness. Liver 14 and UB18, spread liver chi. Sundial 6 circulates chi in all the 3 jiaos. Dana shares an empirical point for the treatment of gallbladder disorders. For a relevant advice, it is important to avoid consuming food that produce dampness, especially foods that are rich in fat and oil. Gallbladder damp cold can be negatively affected by climatic influences. This means that the person should ensure that they are properly dressed and do not live or work in damp places. If spleen chi deficiency or liver chi stagnation is part of the picture, the relevant advice for these imbalances should also be followed. Gallbladder damp cold can be caused by invasion of damp and cold, spleen chi deficiency, liver chi stagnation, and in turn can result to gallbladder damp heat, liver chi stagnation, phlegm, and blood stagnation. So to summarize, damp cold in the gallbladder has its etiology in excessive consumption of greasy, fatty, and damp-producing foods, emotional strain that is prolonged worry, anger, frustration, and resentment. Its underlying or accompanying pathology are stagnation of liver chi, spleen chi and yang deficiency, kidney yang deficiency. The signs and symptoms: jaundice, dull yellow eyes and skin, hypochondrial pain, fullness and distension, nausea and vomiting, inability to digest fats, dull yellow sclera, turbid urine, no thirst, sticky taste, dull headache, heaviness in the body and limbs, and feeling cold. The pulse will be thick, will be slippery, wiry, and slow, and the tongue will have a thick, sticky white coating. The treatment principle: clear, damp, and supplement the gallbladder, force liver chi, disinhibit bile if there is jaundice, and transform damp in the middle burner. For the acupuncture treatment, moxa can be used. We can use the following points: gallbladder 24 to benefit the gallbladder and force liver chi, Rent 12 to harmonize the middle burner, do 9 to drain damp and treat jaundice, bladder 20 to resolve damp and supplement spleen chi, stomach 19 to subdue the rebellious chi, liver 14 to course the liver and regulate chi, gallbladder 34 to clear gallbladder damp, bladder 19 to clear damp and supplement the gallbladder, and central 6 for smooth flow of liver chi. Thank you for your attention.
Let's discuss diagnostic approach in Chinese medicine. 4 methods of diagnosis. In Chinese medicine, diagnostics applies the method of diagnosis to collect clinical information and based on this information to assess the state of health and the cause and status of illness of the patient. It is a discipline that comprises theories, methodology, and skills and has a rich content. It is fundamental to all branches of clinical Chinese medicine. In Chinese medicine, diagnosis depends upon the physician's ability to collect clinical information, to analyze and to infer logically, all without resorting to the use of any apparatus. It is possible to infer the pathological changes in the interior of the body from observation of external symptoms because the human body is an organic whole. All parts of the body are intimately and inseparably linked by the meridians. Because of this meridian system, certain pathological changes in an organ are always accompanied by tenderness in the organ's corresponding acupoints. Conversely, by finding the tender acupoints, the physician can infer which organ is affected by illness. CM diagnostics contain 2 major parts: the methods of diagnosis and differential diagnosis. The principal goal of the methods of diagnosis is to elicit and gather clinical data on the state of the patient's condition and the symptoms manifested by the illness. There are four categories of methods of diagnosis: history, inspection, auscultation, and olfaction and palpation. History is the process of determining the course of the patient's illness from its onset to the time of consultation by eliciting a narrative from the patient or companion and complementing it by further questioning. In addition to the information about the symptoms, a proper history includes the patient's living habits and exposures and the health and illness of family members, including the spouse, children and grandchildren, if any, siblings, if any, parents and grandparents. Inspection means the visual observation of the patient's vitality, coloring, physical condition, and behavior. It includes inspecting the tongue for its texture and coloring and the secretion and excretions. Auscultation focuses on the sound made by the patient to infer the pathological changes within the body. This includes spoken sounds as well as others, such as those of respiration and abdominal cavities. Activities. Olfaction focuses on the odor emanating from the patient and excretions to infer the status of the patient. Palpation of the pulse provides much information concerning the status of the visceral organs, chi, and blood. In addition, palpation of other areas of the body also provides useful information on the condition of the patient or special features of the illness. Thank you for your attention.
Let us now go to epigastric pain. The topic is diagnosis. Diagnostic symptoms and signs in epigastric pain include the nature, time, and amelioration or aggravation of the pain. If the nature of pain is severe, it's an excess condition. If it's dull, it's deficiency condition. If it is stabbing, it's stasis of blood. Distending is stagnation of chi. Burning is heat. And if the pain is with a feeling of fullness, that is dampness. If the time of pain is in the morning, that's an indication of deficiency. If it's in the afternoon, it's stagnation of chi, and at night is stasis of blood. For amelioration or aggravation of pain, if it's better after eating, that's an indication of deficiency. If it's worse after eating, it's excess. If it's better with pressure, that's also a deficiency, and if it's worse with pressure, it's also excess. Better with application of heat or drinking hot fluids is a sign of cold. If it's better with rest, it's deficiency. If it's better with slight exercise, it's stagnation of chi or blood. If it's better after vomiting, that's excess condition, and worse after vomiting is deficiency condition. When diagnosing epigastric pain, questions about thirst, taste, belching, regurgitation, vomiting, fullness, and distension are important. Let's look at the character of epigastric pain according to heat, cold, and deficiency excess. For deficiency heat, there will be dull pain with slight burning sensation, dry mouth, desire to sip fluids, the tongue red with wide midline crack without coating. If it is excess heat, there will be intense burning pain that is worse after eating, thirst with desire to drink cold fluids, with tongue red with dry yellow coating. If it's deficient cold, there will be dull pain with preference for warm drinks and application of heat, with no thirst and vomiting of thin fluids and an empty pulse. For excess cold, there will be severe spastic pain with no thirst, vomiting, thick white tongue coating, and a full tight pulse. If the thirst is intense with desire to drink cold fluids, that's an indication of full heat. If there's dry mouth with desire to sip fluids, it's empty heat or yin deficiency. If there's absence of thirst, that's an indication of cold, and thirst without a desire to drink is damp heat. If the taste is sticky, that's an indication of dampness. If it's bitter, there's heat. If it's sweet, it's damp heat. And the sour taste is retention of food, and the absence of taste is spleen deficiency. If there is loud belching, that's an indication of an excess condition. And for a quiet belching, that's indication of deficiency condition. If it's better after belching, that's stagnation of chi. If there's sour regurgitation, that's retention of food or stagnant liver chi invading the stomach. For regurgitation of thin fluids, that's deficient cold condition or phlegm fluids in the stomach. Thank you so much for your attention.